Hi, everyone, and welcome to the COVID-19 Vaccine Show. I'm excited to welcome to the program Dr. Mark Hayden. Dr. Mark, what's going on? Again, everything you talked about came through. 2 weeks ago, you talked about the poop. And then the week after that, you said certain things. And then bam, everything came out in the news after our last program. And they're all pushing this vaccine narrative now.
Well, number one, do people need immunity? The answer to that question is the highly variable, the highly transmissible variants are widespread throughout the entire United States. In some states like Missouri, they are 96% of what is being transmitted. The answer is that yes, you need immunity. Here's the problem, or actually not the problem, the wonderful solution. Many people in the United States acquired immunity accidentally and did not know it. What we had in the United States was we had a very interactive society that had cars and vehicles and traveled a lot. You had international travelers. During the first two waves, the virus came over to the United States. We didn't have extremely tight lockdowns, even though they said lockdown. People did what they wanted to do, okay, realistically. A lot of people got symptoms. The only time you really went to get tested for a test was if you had symptoms.
Right.
You're not going, and in fact, you were told to stay home if you don't have symptoms or don't have if you're not sure that you had exposure, don't go get tested. And remember, there were a limited number of test kits. And so what happened is probably 2, 3, 4 times as many people actually had exposure and didn't even know about it for every one symptomatic case. So what we're seeing is in the United States, even though the Delta variant is widespread, in Missouri, it's 96% of cases. That Delta variant, when the population is already protected, is not devastating. That same Delta variant, if it was released in North Korea that claims that it has never had a single case, that would wipe out 2-3% of the population.
Right.
That same Delta variant, if it was released in Japan, where they've not had widespread immunity developed because it was already spread through, earlier variants spread through, that would be devastating. The Olympics is set for about a week or two from now. I think it's the last half of July. Okay, so we're coming up in about a week. They're going to look for little or no spectators at the Olympics. They will be very broadly spaced apart. Delta variant is a huge threat to populations that don't have immunity. The US population has immunity, but it has immunity not because the vaccines are so great. It has that immunity largely based on accidental exposure that was never monitored. Now, what we knew is that if you looked at the sewage systems and you monitored it growing in people's intestines, that what would happen is that it would show up in the sewage systems, and it did. So they began to monitor for the Delta variant in Missouri. And in about the middle of last month, they put out this huge warning, says, hey, it's in most of the sewage systems in Missouri.
Right.
And what we should have seen is that those people that weren't officially immunized should have been dropping like flies. They should have been sicker than dogs. They should have been dying like flies. And we know that as the surge happens, about 17 days later, you get your rise in your rate of death. 17, 18 days later, guess what? That death rise is not occurring at all in Missouri. In fact, the cases are actually milder. Here's what's tripping. If you go into a Missouri and you use your ears and you listen in Walmart or Kmart, or actually Kmart shut down, but if you listen in the big stores, listen for somebody cough. They may have just a little bit of hack. They're
Right.
not going to run off to pay for a $50 test.
No.
No, they may have no hack at all. These people are having very, very mild cases. In what would the same virus, if they had not had some immune experience, if they were in North Korea, they'd be sicker than a dog. If they were in China, they would be sicker than a dog.
Why? Because they didn't
have no exposure at all. That's right. Now, one of the reasons I'm the first person. Have you ever heard this, Neil?
No.
You hadn't, had you? You know, I have said from the get-go, one of the things that makes me more confident in the way you do things, the way you learn is to take risk. I have said that, right, Neil?
Yes.
You gotta experiment. I have done more self-experimentation than any other physician in the United States, probably than any other physician in North America, probably in any other physician than maybe in the world. Now, do I quit? I'm not dead, okay? And I'm not sick, and I've never had pulmonary COVID. And I did develop my own oral live virus vaccine.
Right.
And I did patent it, and it is largely ignored.
Do you think it could be used in some places in the world at one point?
You know, it was offered. You know, we went on this show. We taught other people.
Yeah, but do you think if it continues this COVID?
Oh God, yes. You know what the people of North Korea need right now, and what the people.
See, I think the United States is scared about. And can I just jump in this real quick, and then we'll go back to North Korea?
Sure.
Even if they're not deaths, Mark, they are afraid of our healthcare system being overflooded with hospitalizations, like in Missouri. That's the push on CNN right now. I know what you think of CNN, but they are basically stating that this has to become mandatory, the vaccine. Everyone needs to roll.
That's crazy, because I will show to you, based on the numbers, the protection came from regardless to people that weren't vaccinated. Okay, does that make sense?
Yeah,
let me show you. Let me show you.
And all masks are off now too, by the way. Like where it says people that are vaccinated, you don't have to wear a mask. Everyone's not wearing a mask anymore. I mean, I was in the store yesterday, and I stopped wearing one because I'm like, why? No one's wearing them.
Let me give you a prime example. My CPA, and I'm not going to use his name. He did give me permission to use his name, and I got a video of it. He went up to Kentucky, and he picked up a highly transmissible variant up there on a little mission trip for about a week. So he came back, and he was positive. Now, he had never acquired COVID during the earlier period. You follow me? And you know, he's my CPA, so you know he knows my taxes and my tax situation. And you gotta be nice to your CPA folks. Your friends are your friends, okay? And for my CPA and for people that are close, they get better care than, well, I don't know how exactly. I don't want to go into that. At any rate, I went up to his house. I stayed in his house for about 2 hours, face to face, with no mask. Okay, so I inhaled it over and over again. Then I remember, one of the arguments was that they will be expecting you to get a repeat Pfizer shot. Laugh my ass off. I mean, I should not use profanity. That's, you know, to each his own, right? Different strokes for different folks. But I chose not to get a repeat Pfizer. I never had the first Pfizer. I did oral inoculation. I took inoculation 5 times. I inhaled from at least 5 different occasions on the earlier version. I was around him and inhaled for 2 hours. I'm not sick, and my test is negative. I'm not spreading. And hey, guess what? I took the oral sample. I took his saliva, put it in an enteric capsule, swallowed it. Now, remember, I told y'all last year that when I took my enteric capsule, I had a little bit of loose stool about 3 days later. You remember that?
Yes.
No, 0 loose stool. Now, if you call Fauci up, or you called up anybody at CDC and said, hey, Hayden has just eaten live hot virus in a capsule. What's going to happen to him? They wouldn't have the foggiest idea. Okay. They wouldn't know, is it going to go throughout my body and get into my lungs and I'm going to exhale? Why don't they know? Because they haven't experimented. Now, one of the reasons we don't have experimented was because they experimented on Tuskegee Black men with syphilis. Well, guess what? The head of the CDC didn't give himself syphilis. That's the problem. Experimentation on humans is critical. You shouldn't just do retrospective studies. And instead, you have to have people lead the way and experiment. And the people who should do that are not the stupidest people in the group. They should be the smartest people in the group. They should have the best understanding of the risk and benefits. And there are thousands, tens of thousands, hundreds of thousands of Americans who, if they had a program where they could be led by the program research leader, would have volunteered for research. We could have answered many of these questions last year by people that were where the head of the research department experiments on himself and he allows his friends and his family to do that. That would have been ethical. That would have been do unto others as you would have them do unto you. If I'm taking it for myself and I don't have symptoms, that's a state. Then if it's good enough for me and my family, it's good enough probably for most people. What's wrong is when people don't experiment on themselves. Now, Fauci, I think he took his Pfizer vaccine. Good for him.
Okay.
You know, as far as I'm concerned, if Fauci wants to give it to all his children and grandchildren and
I doubt it. You think he really did?
Go for it.
Come on. I don't think he did.
Well, I mean, if he does, that's fine. I mean, that doesn't bother me. He can calculate his risk and benefits. He's pretty informed. Let him inform his own family. But I didn't recommend it for my daughter or my son. You follow me? And you know, now that was different. Last year, was oral live virus probably the best way to immunize people? Absolutely. Was it adopted? No. And that was because of political, it's because of the way the politics was structured. However, now what you're seeing is you're seeing Vaxart stock start to come back. You're seeing nasal sprays that are being developed that have the live virus. So they're starting to move gradually in that way. But a year from now, what are they going to say? They're going to say, hey, guess what? They are going to do this stool surveillance system. And in fact, one of the things that is critical is to do these stool surveillance systems for variants. Alabama, I believe, is a little bit behind Missouri because we don't have variant measurements in the state of Alabama on the sewage wastewater system. They actually measure the variants in Missouri for what class of variant it is. Is it a Delta variant? Encourage the people of your state to track the variants according to the sewage system. Now, here's what we know today. We know today that last Thursday, I took live virus of a highly transmissible variant.
Did you? Okay.
Yes, I did. And here's my test. Here's my test. Okay, you can't see that real well.
Yeah.
I didn't even trust him. Instead, I sent it off to Core Diagnostic Labs, and the lady at Core, she calls me up. She says, "Hey, Dr. Hayden, I got real bad news. That sample you sent us is flaming hot. It was smoking hot." Well, that's the sample I swallowed, lady. I wanted it to be hot. So I didn't want to kind of freak her out, and I didn't have like 30 minutes to do an explanation to her. But that was the plan.
All right.
To swallow a highly transmissible.
Gotcha. So let's look at this. What are you seeing? You're saying that basically we got to stay opened up because of these trends in the United States, based on everyone being exposed. U.S. is fine. The rest of the world is not fine.
Yes. Now let's. I'm sharing my screen with you, right?
Yes.
Okay. Look. Worldwide, is COVID gone away? Absolutely not. Okay. No. Look at the number of cases. Okay. Is COVID going away? Absolutely not, because what you're seeing, and I'll get into that in the last couple of minutes. Daily deaths are down, but they're not out. Okay, worldwide. Now let's go to yesterday. Yesterday's trends was new deaths was 27. What is going on in America? Only 27 deaths. India had 720.
Oh my.
What in the world is going on? Remember, that used to be reversed, folks.
Yes.
Now let's go to USA. Let's look at Missouri. In Missouri, we know that 96% of what's being spread is the Delta variant. Okay. Now let's go to good old Missouri. Let's go to yesterday. Okay, hold on. Here we go. Come on, back. Come on. Let's go to yesterday. Get our numbers.
What about hospitalization?
We'll look at all that. Okay, and
Okay.
I'll go over that in just a second. Hold on. Here we are, Missouri. So total cases in Missouri. Look at how that flattened out. Now you see a little toward the end. I'm going to move my marker over here. You see that? There's a little up spike right here and here, a little curve up, right about in the last week or two. Now, it doesn't mean that the total cases is for every case now. It is more asymptomatic than ever. That means the percent of people that are actually getting tested is extremely low. When I talked to my CPA, and he came back from Kentucky with the highly transmissible variant, he called his other people. They got tested even though they weren't having hardly any symptoms. Guess what? They were positive. So now you don't wait till you have real severe symptoms. If you think you had if you have an unusual cough, you're not having sinusitis, and have any idea that anybody around you might, if you want to really pick it up, you got to go, because don't expect to have severe symptoms. It's not like it was in the first or second wave. Otherwise, you're going to miss it. You're not even going to pick it up. Now look at daily new cases in Missouri. All right, I've got my. You see that over there? Look, we did get a little spike from 621. It spiked up to 1,600, 2,100 there for a day, and now it's back down to 1,000. Okay, but look, that is a little spike. That's the Delta going through. Okay, now what we would have thought, this came through really in mid-June is when the spike blew through town in mid-June, late June. And you talk about highly transmissible.
Yeah.
All right, let me tell you, when we had the first wave, 10, 20, 30% of the people in the room might get it. With the Delta variant, a majority of the people in the room can get it. It is
Oh my
much
gosh.
better. It is.
So
much
why are we
better.
without masks in stores and events and everything?
Which means my version of events, it's not that Delta's not here. It's more like Delta's everywhere, only it's not killing people like flies. Only it's become very tolerated.
Why is that? Because you feel that we had herd immunity, or because everyone has
we
been
actually had massive
more cases of COVID with what's it called, less problems, meaning we had more cases of COVID that were asymptomatic that never were reported.
That's exactly right. And see,
and through intestinal.
That were intestinal growth, and you can monitor it through the intestinal growth.
So this is interesting. I want to look at hospitalizations. That's what CNN's pushing. That's where
now
really shut down.
Let's talk about this right here. Okay. Let's talk about daily deaths in Missouri. Okay.
That's hardly anything.
All right. I'm going. The last death I can find for COVID in Missouri is July 1st.
So why hospitalizations? Go back to hospitalizations. Why hospitalizations?
All right, now, these are not hospitalizations. These are just cases. Okay, these are cases.
Okay, but what about hospitalizations?
Hospitalizations is not on this chart.
They don't have one because this is the big push CNN. All the hospitals are overflooded.
Now, let me tell you how this is going to be spun. The last death I have, we have not had a death reported on this system in over a week from COVID in Missouri. Do you understand that that according to the to the sewage systems, Delta has been throughout Missouri for at least 6 weeks, And yet, even though Delta's throughout the sewage systems of Missouri, there are no new deaths in the last week reported in Missouri. That is stunning. That would mean it is so benign that people don't even, their level of symptoms is so low, they're not even getting checked. Does that make sense?
Yes. So you're expecting,
how can,
let's go with the quick protection. If our hospitals are overflooded with cases, no deaths, but cases, will the certain states shut down?
You know, here's how the spin zone will be on that. Let me tell you this. And if I was Fauci, here's what I would do.
They're pushing the vaccine narrative. Everyone needs to roll up their arm for being patriotic.
Yeah, but guess what? These people who are not dying, half of 40%, only 40% of the population in Missouri was vaccinated. 60% of the population that was exposed is not dying in Missouri. Does that make sense?
Right. Okay. So the point I'm making is, what will the narrative be if you're seeing such a huge narrative in CNN about the vaccination?
Let me tell you, here's how I would play that if I was Fauci. And Fauci doesn't give me advice about swallowing like COVID, but I will give Fauci this advice. Okay, here's how he can spin it. He can come out and he can say, the death rate is down because we're so good at the CDC at treating it now. You see? That's how you spin that. That's what you say is the CDC, we're so smart now at treating COVID that people don't really die because we're geniuses. That's right.
But he doesn't want that's also because some people are using hydroxychloroquine now and also zithromycin, and they're not. Doctors are starting to prescribe that too.
Well, when I went to see my CPA, I looked at his med list. He was on Pepcid. I didn't put him on it. His local medical clinic put him on it. A lot of these things got used anyway. The protocol that Trump was put on, like magnesium and zinc and some of these other things, regular people use those things. Now, what they're going to think is that the death rate went down because of Pepcid, and probably that helps some. Probably ivermectin and these other things help some. But the reality is that variant, which would have devastated North Korea.
So so let's just forget United States. The spin, if they do shut things down or force a mandatory vaccine in certain states where there are not Republican control, where the president of the United States can sign off on this, will that happen? Like a state in Pennsylvania, like New York, like New Jersey, any of the Democratic states. Can you see this happen?
When people find out that Missouri is covered up with an invisible cloud of Delta variant, and yet almost nobody's dying, that once they understand that, once that education's out there, they're not just going to say no to vaccine, experimental vaccine. They're going to say hell no. And the argument's going to be, show me the numbers of vaccinated versus non-vaccinated. Yes, and you can't.
But see,
what if nobody's dying?
The point is
no
that
cases.
States can do whatever they want to do. Correct? Can they make a mandatory vaccine in that state? You have to be mandatory vaccinated.
That's a legal issue, and they probably, they may be able to get away with some of that stuff, but the amount of resistance they're going to meet is going to be enormous.
Oh, it's going to be a huge thing. So the spin is, let's make people who are not vaccinated feel bad, but the thing is that everyone, CNN watching, we're all happy to get vaccinated with Dr. Hayden's vaccine, swallow live virus, and be done with it. But if you've already been exposed to COVID, and you already had COVID, the chances of you getting it is what? And that'll be the way we're going to close out today's show. Okay.
Yeah, let's talk about, one of the reasons I do this show, I don't make money off COVID. I don't make money off my vaccine. This is a public service. It should be I do want to thank the Small Business Administration for their support. The PPP program, I participated in all those. I'm a benefactor of this society, you follow me, so far as the programs. But education is part of the duty of medical care. And really self-experimentation, I would think, is an extension of that. But here's what the take-home message I want you to get to. In Missouri, there was a Delta wave. The same Delta wave would have killed 2-3% of the population in North Korea that wasn't exposed.
Correct.
All right, can we all agree on that? Yes.
So everyone's been exposed to the virus. The virus is not.
Massive exposure. Yes.
What if there's another variant that comes out that's more deadly than this? And
I want to explain. Let me go a little bit further. The people in Missouri that are not dying, and that's 60% of the population did not have their quote Pfizer vaccine or Moderna vaccine, and you will see more and more resistance to it, not just from it being ineffective, but other issues will come up on it. Those people were actually protected accidentally. None of those people that had exposure in prior ways did it intentionally. They didn't intentionally eat it on their food, did they?
No,
they didn't. No, they didn't. And really, when you tell people that Dr. Hayden ate COVID, they say, well, he ate it, it was in a capsule and he swallowed it. And they will say, oh, that's gross. Okay, that's sick. Saliva's grotesque. It makes me want to vomit just thinking about Dr. Hayden eating somebody's saliva that had COVID in it. And that's okay. But guess what? They were eating takeout for months. And those people making that takeout, they were breathing that virus all over their food.
Right. It's just like having a cold. You're going to end up, people are sick. You're going to get sick from that.
They were living in an invisible cloud of SARS coronavirus being breathed over.
So we pretty much had that spin, Dr. Hayden. I want to jump back to this point.
All right.
Two things. One, worldwide, will the virus shut down part of the world or make it again difficult to beat? But we know Canada is still not opened up yet. Do you see another push and burning problems in other parts of the world just because?
Absolutely. Let me tell you what this has done. If you look at North Korea, they make a lot of their income through tourism of the Chinese. The Chinese come over to tour North Korea as a communist country, as an example of pure communism. They can't do their tourism business because these people will be contaminated and their population has never had any experience with any coronavirus. That means that in North Korea, the best way for them to resolve it is to use probably live oral vaccine.
Okay.
And to protect their population. And the same is true of China.
Makes complete sense.
Yes, you will see, I believe that you will see China develop an attenuated vaccine that is either nasal or an oral vaccine within the next.
Dr. Hayden, you got to go to China right now. Get on the plane and get to China. No, the last point. What if there is another variant worse than Delta?
Okay, now I will tell you this. Our lives, and I've told you this.
Yes.
Many times, that my days are numbered, meaning that a lot of times when I do things that seem to be very risky, I have to ask myself whether the risks are worth the benefits. I have to calculate those risks. But I know that if I die in any good cause, whether it's research or we all die.
Yes.
We don't pick the day we choose to die. Our days are picked for us. My appointed day to die is picked. Those people in Missouri didn't die because it wasn't their day to die. They were protected by accident, not by intention. So the people in Missouri accidentally protected themselves by accidentally inhaling and by accidentally eating the virus. Inhaling virus is very, very, never inhale virus. Okay, and above all, never inhale. But accidentally eating the virus protected millions and millions of people in Missouri. Now, that having been said, we now have asymptomatic spread of highly transmissible variants, which is one of the things. Remember, I said you're going to get a variant that is better and better aerosolized. That exists now. That could get modified in the future and have devastating consequences. So where it could rip through a state within a week or 2 weeks, and the fraction of people, if it contains
And the
a toxin,
vaccine's never going to stop it like an oral
No.
vaccine. Only
not,
one
not
will
the,
work
not
as
the,
oral
not
because
the
you have to-
vaccines that not the Pfizer, the Moderna are not the answer for that. That will not cut the mustard. And from a biological warfare, that is not the toxin mutation. The typical pattern required an autoimmune response that killed you in 17 days. A biological toxin that was aerosolized would kill people within probably 2 to 3 or 4 days.
So why hasn't like Al Qaeda or any of those places decided to create one?
And I tell you why. You have to have gene splicing techniques. That's not available. Little Afghanistan Taliban people, they don't have that stuff. That is it is really people in Western countries, in Western universities that have gene splicing
Which would never play God like that because they know that would cause.
Yes. But is that a future threat? And when North Korea looks, they live in fear that somebody's going to further weaponize that virus, but they can't let their fear be so bad that they don't live by faith.
Okay.
And that sounds kind of crazy for me to tell people in North Korea, you have to live by faith.
Okay. All right.
But you got to. All people everywhere are living by faith. Their day to die is going to be their day to die, and they need to do the right thing whether they die or not.
All right. So you finish up every show with one saying you always say.
Yes. My days are numbered. Lord, teach me to count my days. My days are numbered. Make every day count. And I hope you make every day count. Realize that you right now may have protection from Delta virus accidentally. It may not have been your plan at all. You may have already encountered Delta variant and not even known it. And that's the beauty, that these things didn't happen by accident. Some people will say everything in the universe is just an accident, but I don't believe it is. I believe that God has a purpose for your life, has a purpose for my life. And you take each day and use those moments, because we're not promised tomorrow. We certainly aren't. And make each day count and live by faith, live by trusting God, and learn all you can about science, but don't ever believe that you can outthink your fate. I don't think that I can change my fate to my day to die. Okay.
Exactly.
And I consider myself an expert on COVID. So, right. But just because I don't die of COVID, don't mean I'm not going to die of plane crash, heart attack, stroke, etc.
All right. Sounds good, Dr. Mark. Appreciate it. Again,
you take it easy and have a great day.
All right. That was the COVID-19 vaccine show, guys. Take care.